Hello, 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 assalamu alaikum. Good morning, Khushamdi, Jiayanu, Pakhair Rakli, Goedemorgen.
Ni hao, chule shumme, washvale, Ohio, gozaimas, guten morgen, hola, bonjour, privyet, kaifa hal, hale shuma chatore, ahlan wasalan, marhaba, and a very amazing good morning to everybody who's tuned into PT World and are watching World this morning alongside the very amazing Shiza Hashmi and Shahzad Khan. Hello Shiza, how are you today?
I am good, but the question is, how are you, Shazad? Are you any
Well,
better than yesterday?
well, it's not like that I'm feeling better, but there's one thing which I would definitely want to talk about, and that is that, ladies and gentlemen, the virals out there, they say, and it's a very famous saying that when summer's ending and winter's coming, you
Yeah.
really have to look after your health.
True.
And I think this is something which happened to me as well. There was this other guy, or probably I don't know who actually shook hands with me, never told me that he had the viral or probably flu or whatsoever it was, because, ladies and gentlemen, these virals and this flu is actually contagious, and it can get to other people as well because of the fact that you were sharing a meal, or you were sharing a glass of water or a bottle, or you were just shaking hands. So please make sure that you never shake hands or hug anyone or kiss a kid when you've got a viral or when you've got an infection or flu which is contagious.
Yeah, I mean, we have discussed this before as well. Yesterday I did that because this is because of the weather fluctuation, weather change. So please be
Yeah.
sure that you don't immediately or abruptly walk out of an air-conditioned room and walk out into the sun or, otherwise as well. But other than that, ladies and gentlemen, it's Tuesday and we have started the week with a lot of energy yesterday. We tried to at least, but our energy factor is back.
Thank
And
you very much
we
for that.
and we're hoping to have a great week with you guys.
Exactly. But before we move on, there's one more important thing, because we're not including top stories today, ladies and gentlemen, and it's only because of the fact that today is 11th of September and it's the death anniversary of the father of the nation, Quaid-e-Azam Muhammad Ali Jinnah. So there's one thing which I want you to say, and that was that I think as people, as nation of Pakistan, what we need to do is that we need to align with his vision where he talks about, I think there's just one thing which I wanted to talk about, and that was that, you're free to go to your temples, you're free to go to your mosque, you're free to go anywhere you want to worship. So I think, and that was a message by Quaid-e-Azam Muhammad Ali Jinnah as well. So we need to be an inclusive society. I think that's what we need to work on from today onwards. What about you? Do you want to say something?
Well, I totally agree with whatever you said, and I think we absolutely value all the efforts that he's made for Pakistan. And this is why Shahzad said that we have to keep our vision in line with his vision, because his ideology is what Pakistan is.
Amazing that is. But with that, ladies and gentlemen, now let's just indulge into what we'll be talking today. Okay, now this topic definitely relates with Shiza quite a lot. Not really with me, because of the fact that when I have to be on television, I might have to get a little bit of dap done or makeup done. But other than that, ladies over here will talk about what we are going to. What's the topic of discussion today?
So today we are discussing something that is going to bind all of you ladies to your screens for an hour at least, as long as we're talking about it. We will be discussing, first of all, skin issues and then how to take care of your skin. Other than that, some makeup trends and dermatology and cosmetology, the trends and everything. And, lately, so just before the show, I was talking to Dr. Shireen over here,
Yeah.
and we were discussing the Kardashians. So the mother, she's 60 plus, and her skin.
Which mother? The father mother or the mother
No,
mother?
Kris Jenner, the mother.
Okay.
Yeah. So her skin is better than her 18 or 21-year-old daughter, which is wow. And it's because of probably social media. I feel like it's because of social media or probably exposure that we're getting every day. We're looking at models, we're looking at these public figures like Kardashians. We all want to look perfect. We all don't want to age. Although my personal belief is that age is a natural concept, and I personally want to age gracefully. I want to go with it. I mean, it's only natural, right?
Exactly, that's what it is. And I think I'm going to agree to you as well, because this is the first thing which I always come up to my head when somebody tells me you've got wrinkles on your forehead or probably your double chin's coming out. Look, there's this one thing. When you're not supposed to have wrinkles is that particular age, probably from the day you were born till you're 30 years old. Now, what Shiza said that she wants to age gracefully is the same with me, but it's not because of the fact that it's going to be graceful. It's because of the fact that I want to live with each and every scar life is going to give me, so that by the end of my life I can actually tell my grandkids that, see, this is how you actually need to live your life. But other than that, everybody's got their own preferences, their own choices. You wanted to add?
Yeah. That's true. Everybody's got their own choices, and this is what actually we're talking about today, because this is a growing trend lately in other parts of the world as well, in Pakistan.
Yeah.
Because over a few years recently, as we're going to talk to our guests as well, that there is sort of a paradigm shift. I mean, we sort of became okay with the idea, with the concept of taking care of your skin and your looks and just looking young and perfect all the time, but just few years back, we were not the society that we are today.
Exactly.
So I think before we do introduce our guest, should we go on to a short break?
Yeah, we can definitely go on for a short break, but there's just one more thing which I wanted to add, and that was that, ladies and gentlemen, our daily routines, what we do in life, what we eat, the way we sleep, the way we are out in the sun, all of these things will have an impact on your skin. Even your skin layers, they just get thinner and thinner.
Yes.
Then you have those puffy eyes. So with age, everything's going to happen. But if you want to stop that, all you have to do is keep on watching PT World, because we'll be right back after a short break. Don't go anywhere. We'll be right back. Good morning.
Well, ladies and gentlemen, this was a short break, as we said, and for those who have joined recently, we are talking about youthful looking throughout your life, if you wish to well, and we're talking about cosmetology procedures and the latest trends and everything. And I think we should just start with our guest.
Yeah, let's do it. So, ladies and gentlemen, on my right-hand side, we're very grateful that she made it to the studios too as well, because it's early in the morning, even though I think that she might have to be at her work too well early in the morning, because of the fact that, ladies and gentlemen, that she is head of department, Polyclinic Hospital Dermatology. She is none other than Dr. Shiri Ansari. Hello, assalamu alaikum, how are you? Walaikum assalam.
Good morning. This is quite late for me. We are at work by now.
Wow, that's great. Thank you very much for joining us. So while we went on the break, you said that you have to disagree to a few points we made. Yes. What are those disagreements? Let's start from there.
The first thing is that I think, in my experience, men are just as interested in cosmetology as women.
Looking good, yes.
Second thing is that, I often tell, I agree on this point, that I often tell my patients and clients that, before 30 you have the face that God gave you, and after 30 you have the face that you deserve.
Or which the doctor gave you.
But, the trend or the wish to look youthful is not new. It is since the times of Cleopatra, or even before that, if we remember. So this is not something new. It's just that we have more options now. And why not? If it makes you look good, why not go for it?
But if you have to go through so much pain, what's the point? People who are actually going for their chin up lifts, straightening up their nose. I don't even know what the correct terminology would be for all of these things. But why to go through so much pain when you're not even on television? I've seen people who just for the sake of it get it done too as well.
Of course, there has to be balance in life, in everything.
Exactly.
And a question which is very commonly asked is that up till when should we go for all this? And I'd say by the age of 65, 70, then age gracefully. And before that, you can, just like you want to look good, you make a new, joda. So, you can just go for some maintenance kind of things
Right.
that will that hopefully should not be overdone.
Exactly.
And you shouldn't look like somebody else,
Yeah,
but yourself, but better.
Okay, a better version of yourself.
Yes.
I think that's the right way to put it as well. You know, you've said it very well that, you know, after 65, 70, just age gracefully. That's the best part. But ladies and gentlemen, we should never ever get onto the top as well. Okay, you know, let's get that, let's do this, let's do that and whatnot. Because there's this lady, I don't know from which country, who actually undergone 100 or more surgery as well
Korea.
just to look like a Barbie doll.
Oh, that, okay, not
yeah, and
Korea.
then there's another one as well, who, and she is actually a billionaire and she just invests on looking like a cat. So, you know, that's not striking a balance. But other than that, you know, let's start from here. What are those things, what are those habits or characteristics of our own within our own lives which actually help to age faster than you're supposed to age?
Well, I would say top of the list
Yeah.
are two things. Of course, your lifestyle or the way you live. I'm sure everyone has heard about antioxidants.
Yeah.
And there are free radicals or oxygen-free radicals in the skin that are produced with many things, with stress, with environmental factors. And so to diminish those, get a healthy lifestyle. Step one, you know, do your exercise for tissue perfusion, better blood supply, at least 5 helpings of fruits or vegetables every day to remove the free radicals, because fruits and vegetables are antioxidants. Then the sun protection, that is very big and very important. And there are two kinds of, mainly two kinds of sun rays that are affecting the skin, the UVA and the UVB. The UVA is the one, the culprit that will, you know, destroys the elastin and the collagen. So our base or our, you know, support system goes. And UVB is for, you know, that causes tanning and color discrepancies. So sun protection is top of the list when we come to products.
Exactly.
You know.
But then at the same time, you know, we all know skin, I think, is one of the, I don't know how to put it, biggest or largest organ of human body.
Yes.
And we really do not tend to look after that quite well. But there's a difference of opinion too as well. For example, when you go to the north, you know, the UV rays are more stronger over there too as well. But people do not have a concept of putting on sunscreen, but they're still so beautiful. They don't get a tan. So
My
are,
dear-
are
But they
there
do
different
have
skin
rashes on
types?
their-
Are
No,
there
no.
different skin types?
Of course, there are different skin types, but you go to the north and you just look at the very young and beautiful ones, but you don't look at that just when they turn 40, they are full of wrinkles. And we get, you know, quite some skin cancers from the northern areas because they are not protecting themselves and the mountains are reflecting the sun into the valleys, and there's a lot more radiation there.
Okay, Ms. Shiri, Dr. Shiri, that you've been working in this department for about 20 years now. So you have seen the change of, you know, a paradigm shift that we were talking about. First of all, why do you think and how do you think has it become so common to, you know, to have these procedures on yourselves in Pakistan? And also, what are some of the most common procedures that your clients come up with that, you know, okay, this is what we want?
Yes, certainly there's a paradigm shift and there's more awareness. And I do think that media and people like yourselves who look good and, you know,
Well, you're just being
beautiful
generous. Thank you.
are certainly playing a role, and everybody wants to look good. Like I said, you know, why not? If you can afford it and if you feel like it, then go for it.
Definitely.
The commonest things, of course, the common is the most, not common, but I'd say favorite procedure would be now at this time, the PRP. Because that's like a breakthrough and that is helping so many problems.
So let's talk about PRP. Explain to our viewers what it is.
The PRP is the platelet-rich plasma, and this is used in many specialties. The orthopedic people are using PRP, the gynecologists are
People who are getting bald, they're using it too as well.
we are using for hair, where you know, we didn't have this kind of option ever before. And also you might have heard of the vampire facial. So for rejuvenation,
Oh my God.
for rejuvenation. So what is PRP? PRP is, you know, your blood is drawn like in a blood test. It is centrifuged and then the plasma element is taken off and it is prepared and activated. And wherever this platelet-rich plasma goes, it it stimulates the mesenchymal stem cells, which are
we don't know
cells.
what it is,
Okay,
yeah.
which are cells which are undifferentiated.
Okay.
So if we inject it in your scalp, new hair.
Okay.
If we inject in your on your face, new skin and
So they're just
rejuvenation,
growth
baby
cells.
skin,
They can be
Yeah.
used
baby
anywhere.
skin, and very, very nice effects and very effective.
Yeah, but there's just one thing which I wanted to ask, and that was that it's fine that you inject these plasma or whatnot, and then there are these laser techniques, hair removal, whatnot. But what I've seen is that these are not permanent solutions. After every 6 months or 4 months, you still have to go to the doctor, and then it becomes a part of your life, where after every 6 months, 4 months, you're just going to the doctor.
Okay.
So how do we get rid of that? And what is the life expectancy of all of these injections which we inject, which, for example, maybe PRP or lasers or hair removals or all of this stuff?
Okay, so different procedures, you are right. Everything has a, human beings
A
have
time frame, yeah.
have a time frame. We are also all going to go. So nothing is forever. There's no forever. It's like a maintenance thing. So in the case of PRP, you can go for a year or year plus, for example. In laser hair removal, which is, I would say, our bread and butter, that is also not just cosmetic, but I think it has helped and changed many lives. Because if a young woman has hirsutism, that's not fun to live with. And that, after about 4 to 6 sessions, well, it's kind of permanent, really.
After 4 to 6 sessions.
Yes.
But that's just in case of laser, right? Hair removal.
Laser hair removal.
Right.
The other injectables like the botulinum toxin, which is also a very commonly used, it is in fact in the US the most used cosmetic procedure. Botulinum lasts about 6 months, and that's it. And the filler injections, they will go for about a year or a little less.
Okay, that's great. But before we head on to a break, there's one thing. And since you're a head of department of a public institution, it's a government institution, polyclinic. So there's one thing which I wanted to ask, and that was that obviously if somebody comes up with a skin disease, that's fine to be treated within a government hospital or facility. But what if somebody comes for, can you give me fillers, and you're at a government facility? Is that happening in Pakistan?
No, unfortunately not.
Because
we are not there yet.
Yeah,
We are really not
I
there
think
yet.
that's great. But with that, ladies and gentlemen,
Let's head out to a short break, and we will be back before you know it. Stay tuned to PTV World. Good morning.
let's do it.
Welcome back, ladies and gentlemen. We are back with a better and more interesting segment. But before we move on to the introductions of the new guests that we have over here, I have a question for Shahzad.
Go ahead.
It's related to makeup and everything. Since you are, I'm sure you don't know about it, but you are a part of the industry, so you should.
Yeah,
Okay.
okay.
Do you know what no makeup or what zero makeup is?
Well, I think I have an absolute idea of what zero makeup is, and that is right in front of your eyes. So this is zero makeup, ladies and gentlemen.
Okay, wow,
Even
yes.
though I had to put on base, I think that's what it is, and then a little bit of puffing. That's it. And I think that's what zero makeup is.
Yeah, but for girls, you also fill your eyebrows, and then you also sort of little contour to,
Yeah, there's something which you can probably shed light on. What do you think is zero makeup?
So for me, I usually, when I'm not working,
Or let me answer that. Very, very sorry for that. So zero makeup is when you actually know that she's not done makeup and she looks the same as she was before makeup, or there's a
But
difference?
better. There's a difference in terms of, you know, you have beautiful lashes because you've put like this minimal mascara on your lashes, but it
Yeah.
looks better. You have filled your brows, so it sort of looks natural because you're not wearing any color on your face, but you're
Okay.
also just defining what you have.
Okay, so we'll ask our guests, ladies and gentlemen. We have been joined by somebody who's a dermatologist and a cosmetologist too as well. She's none other than Dr. Asrana Rizwan. Assalamu alaikum.
Walaikum salam.
Thank you very much for joining us. Alongside Dr.
Thank
Asrana,
you.
we've actually invited somebody who's actually going to tell us how to do zero makeup. So she is a beautician, she's a makeup artist. She's none other than Miss Sana Amin. Hello, assalamu alaikum.
Assalamu alaikum.
Wa
How are
alaikum.
you?
Thank you very much for joining us. And last but not the least, ladies and gentlemen, we have a victim too over here. And she has actually given Sana the permission to do the zero makeup on her face. So she's none other than Miss Atiya Noreen, and we should actually give her a big round of applause because she won't be speaking today. All right. So thank you very much for coming over. First things first, so that you can get started. What is zero makeup?
Actually, zero makeup is the same. She has told you that we do the makeup, but if you look at the face, you can't judge that if we have put some makeup like you have done.
All right.
A lot of makeup, but you're saying
Not a lot of makeup, come on.
there is a
I mean,
base,
you know it, you're a witness to that.
contouring and everything is there, but still you people are saying that this is no makeup, that we are not wearing makeup.
Okay.
Whenever the women are wearing makeup, you people are saying that they wear too much makeup.
Okay.
Yeah.
Now
But
I have,
you know, I really don't care if anyone tells me I'm wearing a lot of makeup. I mean, it's me. my
Yes.
choice.
So I think what we need to do is that we actually need to take a picture of Miss Atiya Noreen over here. So if we
Before
can
and
probably
after.
cut her, cut her so that the audience can see her too as well before the makeup, and then after the makeup we'll do something. So okay, this is how Atiya looks, and she's not wearing any makeup right now. Atiya, are you wearing any makeup? Or just a little? Okay, she's being honest. She's saying yeah, just a little bit. So that because of the fact that we do not have that much time. So there you go.
Okay.
Please do that, and then by the end we'll actually ask you what you have done as
Okay.
well. All right.
Okay.
And meanwhile, I'll move on to Dr. Asrana. So every day, we get our faces. I don't know how to ask it, so somebody else's puff on your face, somebody else's finger on your face, and whatnot. A lot of makeup on your face too as well.
Yeah.
What kind of effects does it have on your skin or your facial skin only?
first of all, thank you very much for inviting me in this program. The second thing I want to say that if you put a lot of makeup and the different puffs and different things, that's not good for the skin. That cause the harmful effect on the skin. Mostly it causes more and more of if the skin is more prone to oily skin, then it will lead to pimples and the dirtiness, and it will also lead to the rough skin, and the skin will get sensitive and dry with more and more of the makeup. So it's better just use a little makeup or light makeup. That's very good.
Because I have a habit of just not washing it off. So till the time I'm not sleeping, I'm not washing it. So just because I wanted to look fresh, that's what the point was. Do you think it's going to have more adverse effects than just getting makeup done after work? Just clean it up and it'll be fine.
Yes, Shazad.
Yes.
All right, let me ask. Yeah. Go ahead, please answer.
Yeah. I want to say that one should clean the skin, moisturize the skin. This is very important, and one should be neat and clean. But lot of water, that's again an irritant. More of the water should not be used. That again cause harmful effect. More of the touching of the skin all the time, picking of the pimples, and just opening it. That will cause more of the scar formation on the face.
Alright.
So it's always good that you keep your skin neat and
don't let
properly.
anybody touch it.
Yes. Yes, it
Is
causes
that
the harmful
important?
effect because it contains a lot of bacteria and our hands are not free of anything.
Right.
So
Do you
it
agree
will
with,
be.
what Mrs. Rana said?
Well, yes, primarily, yes. Don't pick on your skin, please. And don't keep, I often tell my acne children who come to me that please tie your hands behind your back so that you cannot touch your
No,
face.
but what are some of the reasons that you guys have identified over this time that might cause acne or some of the most common skin diseases? Well, let's talk about this area specifically because I think it's also related to weather sometimes, the
Because-
atmosphere, the
Yeah.
environment.
Winter's just around the corner too as well.
The causes of acne we want to talk about, well, it's mainly hormonal. And I will not agree with this that it's a seasonal thing. It really is not. It's hormonal, it's age related, it's the time when the sebaceous glands become very active, produce more oil, they clog the pores and the bacteria comes in, and that's acne. It's more a teenage problem, but sometimes it continues into the 20s and 30s.
And then let us just very quickly go back to what Miss Sana is doing. So Miss Sana, what's happening over here? Huh?
I'm not doing anything.
You're not doing anything. We know that we
nothing.
call it zero makeup,
Yes.
but it needs to be done too as well. So it's not zero makeup.
No, it's not zero
So
zero.
what I've seen is that you've applied base first of all.
Yes.
Yeah, that's
very,
something I've
very
seen.
light base where it was needed.
Okay.
Just to
Like, I'm
conceal,
not-
right?
Yes.
Just to conceal.
Yes, just to conceal.
But
Nothing
what are we
else.
trying to conceal?
Blemishes, dark
Blemishes,
circles,
dark
whatever you
circles.
have.
So at all, that's why we've got dermatologists over here. So other than what was the word?
Blemishes?
No,
Blemishes.
conceal.
Okay.
You're
Conceal.
fine. So other than concealing, what are those apparatus with, due to them, I think we can get rid of our blemishes? That's what you're calling?
Yes. The first point is how the blemishes occur. The most important reason is when you go in the sun exposure and you don't use the the normal quantity of the sunblock which is required.
Okay.
People sometimes they use the sunblock, sometimes they don't use. That lead to photoage spots and the other blemishes which occur with the passage of time. And it also, the aging skin also gets some of the spots. So one should go with some of the things which are required for that skin, that the cleanliness is very important. Then the sunblock application, that's very important, and you moisturize the skin. And then the patient, if the blemishes are there, then the patient should come to the dermatologist so that we can recommend some treatment, some creams, something, or some of the procedures. Like I do the mesotherapy and PRP and the chemical peeling. These are the procedures which are done to treat those blemishes.
Somebody told me that you should always have your own makeup kit. You should always carry one so that somebody else's makeup is not used onto your face. But unfortunately, what happened was that whenever I bought a makeup kit, and it was always very expensive, but my family members took it away. My sisters, my mother took it away, so I never got a chance to actually keep my own. Do you have a solution for that?
You'd have something compact that you can keep in your pocket.
Yes.
secretly.
I think that's something which we need to do too as well.
That's true. But
You should get one for each of your sisters as well.
Oh my God.
oh, that's a solution.
Okay, I'll try, Api.
But it's
Yeah.
very important that the things should be separated. Actually in the parlors, what happened, the same brushes, in some of the parlors, not all them, the same puffs and all the things, they are being used. So what happened that we carry the infection from one person to the other person. I
Do you
see a
do
lot
that
of
at your
patients.
parlor, Sana?
Because nowadays customers are more aware. They
that's
know
true.
what things can happen.
Yeah.
So they are more aware and they always ask for new sponge or new things. And after using it, we used to sanitize all the brushes as well, because we know these things, germs are being transferred, and face is a very sensitive area.
Okay, but I have a question for both of you. So this has happened to me as well. A lot of my friends I know. So every time, if you opt on, using wax instead of laser, what the beauticians say is, oh, you're gonna get wrinkles sooner than you were going to get them, anyway.
And
Is
you
this
can
true?
charge your consultation afterwards the show too as well.
Is this true? Okay.
No.
Let me put it that way. Is laser hair removal better than waxing it off?
Absolutely yes.
Okay.
I'll tell you the reasons.
Okay.
Laser hair removal, you have to understand that it has nothing to do with wrinkles, number one.
Right.
Laser is a light, and the light that the laser hair removal equipment emits is absorbed selectively by the pigment cells of the hair. And the light energy, it changes to heat energy, and the follicle is burnt out. That's the science. That will not cause wrinkles. It is, a kind of long-term or permanent solution. It will get rid of the complications like folliculitis, which often happens after waxing
Most of the
or
time we see
ingrowth.
the folliculitis
Yes.
and the pimples
The
appear
follicles
after
come out.
waxing.
No.
What do we mean by
The
that?
folliculitis
Ingrown
means
hair, right?
ingrown hair also happens a lot after waxing. And also folliculitis means that the hair follicles get infected, bacterial infection.
And ingrown hair are very painful too as well.
So you avoid all of this if you can go for the laser.
Okay, and it's not painful, the laser treatment.
It's very
Because I've seen a few
doable.
videos on internet.
It's not. It's
This
you're
is how
not-
laser works.
It's not
not really
painful all the
painful.
time.
Not
Okay.
really.
And moreover, some of the time when the patient is more sensitive to pain, we can apply the numbness cream before doing the laser. So the patients do not get, my patient do not get the laser pain.
Okay.
And one has to counsel the patient as well that there will be a little bit pain, but no pain, no gains.
We were just talking about vampire facial. Are you doing vampire facial as well?
What is that,
Yes.
first of all? I
Okay,
need to
so
know
I will,
about it.
I will try to explain it to you. So what I know, it's micro needling. So it's also a PRP, right?
Yeah,
We
it's
can
PRP.
explain.
It's
Please,
PRP.
Please go ahead.
Gee, it's PRP
For the face.
for the face, and it's done with you know, different gadgets like the derma pen, for example, which has micro needles, and PRP is absorbed into your skin via micro needling. Now, if you go you know, beyond a certain level, it can become little bloody, and that's why it's called also it's called vampire facial, because you are using a blood product.
All right, all right.
Actually, the PRP is meant by, what do you stand by PRP? That is a platelet-rich plasma.
Yeah, we've talked about it.
You have already
Yeah,
told
yeah, yeah, we've talked about it, but it's great. But now let's come down to a few
because
basic.
we take the blood of the
your
patient
own
and we
blood
use the
glucose.
plasma.
Right.
That's why when you do the micropuncturing by the microneedle technique, then the small vessels, they get rupture.
Okay.
That's very good for the skin, the new collagen to build up.
Also, so how long does it take for the effects of the PRP to surface?
I just see the PRP, the patients come to me after 2 weeks. And sometimes I do PRP after 3 weeks or 1 month, but the patients feel happy. After 1 week, they say, sometimes they call me and they say that we got a very good result.
Okay, okay.
So it give the immediately the patient don't get happy because of the lot of micro punctures.
Bleeding, yeah, and
But
it's painful
after
as well,
3-4
right?
days or after 1 week after exfoliation, the patient get a good skin, and the patient feel very happy with a glowing skin
Okay.
and a brightened face.
Okay, I'm sorry that I'm bringing this up, but a lot of people over here within our own country does not really want the skin color they have been given by Allah Almighty.
I love
And so what they do is that they actually go to dermatologists to get a whiter or a darker skin. I don't know the population of the whiter is greater or the darker is greater, but how many procedures do we have to undergo just to make our skin color change?
The-
Anybody want?
I
Let's
know
A
start
lot
with
of
you.
procedures
Okay.
doing.
The thing is, rule number 1, I think we should be happy with the complexion we are
Definitely,
born
yeah.
with. But there is this obsession to being, you know, fair
Yeah.
in the subcontinent,
In our
I should
country,
say.
yes.
Yes.
Obsession, and the
subcontinent.
second point is the society wants that the girl should be fair.
Yeah.
So that's
For
a,
the marriage
that's an issue.
couples.
Now the commonest things that, of course, the whitening creams, and some of them one has to be very careful because they contain heavy metals, and that is a that can be a cancer producing also. Then there is the injection glutathione,
Yeah.
which also has to be very carefully given, because we should have a test dose so that we know that there is no reaction to it.
And there can be reactions.
There can be.
Okay.
And also I think that, I don't know if you will agree with me, but I tell my clients that, go up to 3 injections, and if it's making you look good, well and good. And if it's not working for you, then stop.
Okay.
There's no unlimited procedures. should
Actually,
be
I
done.
tell my patients that they can have the first dose of 6 injections, 1 injection weekly.
Okay.
Some of the patients, they go for twice after 2 weeks, 1
Okay.
injection after 2 weeks or fortnightly. And some of the patients, they also ask, they say that we want 1 injection per month. It's okay, but first they should take 6 injections, and after that we can decide whether it's working for the same person or not, because people have different kind of skin and people have lot of opinions that they want a very fair skin. But actually what happens is that with the whitening injection, only 2-tone skin get better with 2-tone,
Yeah, this is
not
what I
too
was,
much of the whitening.
Yeah, this is what I was about to ask, that a lot of times, for example, when you get your makeup done, so what women do is that, they probably have makeup done till hair, or probably just a little on their forearms or hands, but they just forget about feet. So I hope that this is something which is not going to happen with injections. It has an impact overall on your skin.
Overall.
That's great.
But
But we very quickly have to move on to our beautician over here. So what have you done? Let's see.
Explain all
Okay,
the
go ahead.
procedures, what
Okay.
you've used. And
I think, Atiya, you'll have to face us too as well, so that we can see you too as well. So let's see if that's zero makeup. No, you can face over here.
You can face over there.
Well, she looks the same, honestly.
that's the point.
Yes. Okay, so what have you done? So for all those ladies who are out there, please explain it to them.
Actually, I have done a little bit. I have used a little bit of foundation where it was needed.
Okay.
Like I didn't put too much makeup on her face, and a little bit of light color on the eyes.
Okay.
Okay. And I have contoured with a little bit of dark color.
Okay.
You can use a liner, but you have to smudge that. If you don't have that, you can use a dark color on the eyes. And then a little bit of mascara.
Okay.
Then on eyebrows, a little bit of
Brow powder. Or,
brown
yeah.
shadow.
Okay.
And blush on and light lipstick.
And that's about it.
That's it.
Well, and that's simple, ladies and gentlemen, and that's cool too as well. You
And
look
you're
great.
good to go anywhere.
Yeah, exactly. That's what it is, and I don't think that it's going to cost you much as well. And then, other than that, if your husbands are parked outside, they're honking on the
Yes.
cars, please come, be quick, and all of
You
those
can
things.
you
You're going
can
to
do
get
it
rid
in
of
the
that
car
hassle.
as well.
Oh,
You
yeah,
can do
yeah.
this makeup in the car
as well.
Yeah, okay, but Atiya, we want to ask you whether do you think that there's need for more makeup on your face, or you're just satisfied with?
I'm satisfied.
So this is the makeup which you get to do at your homes too as well, you know,
Yes.
while working. So
Actually,
whatever.
nowadays, too much makeup is not in the trend, and
Okay.
it's not in the fashion.
But do you ever think that bridal makeup is going to go towards no makeups, maybe sooner or later?
Actually, this is the
you're,
noodle makeup.
if you go
Nude
outside
look.
in
Nude, yeah. People
European
like it.
countries, you have seen their makeups as well.
Yeah.
They're not doing, but in Pakistan, you have
Internationally, this
Yeah.
is the recommended, the nude makeup.
Okay, but very
the
quickly, I'm
neutral
sorry
makeup.
that we are putting ourselves under the spot too as well. So now what you have to do is you have to tell the flaws of our makeup. You know, so
Be
let's
generous,
see.
please. But
Yeah.
yes, please.
Yeah, so let's see what's wrong with us. Go ahead.
I can tell you after the show.
No, it's perfectly alright.
You're right, you're right.
Perfectly
Okay.
alright. Be confident about it. You know, we can get a better makeup done. Probably tomorrow we can have her over. Yeah, go ahead. So tell us
When
what's
I'll be
wrong.
doing your
I
makeup,
know my
I will
nose
tell
is
you.
not straight. Yeah, that's cool. That's one thing. Go ahead.
Contouring is missing on your
Okay.
face.
Yeah.
And otherwise, you're
That's-
mashallah very,
Oh, thank
handsome.
you very much. Thank
You don't need actually makeup. Why you're wearing the makeup?
Okay, that's great. Thank you very much for that. I think we're now going to move on to Shiza over here.
Yeah, we'll talk after the
Yeah,
show. Sana.
but to our doctors.
Mashallah, she's looking very nice.
Thank you very much for that. You do definitely
She always
do.
look nice.
Thank you so much.
Oh, that's great. So towards the end, anything you want to share with people who are out there, you know, if they're using any medications for their skin by their own selves, because mothers have this habit of putting on neem ka pani and whatnot and all of those, you know, things which we do at home. Do you think that
Absolutely.
they're in our favor?
No, I think that all the things that ladies like to put on their face, if they were to have all those nutritious things, honey and yogurt and eggs, they would look good anyways.
Amazing.
So-
Come, Saima.
I think the over-the-counter medicines should not be taken because they are harmful in most of the cases. And one should consult the dermatologist for their problems rather than going to the pharmacist and other
And just
people
doing
and
it
getting the
yourself.
medicine.
Thank you very much for being with us. It was lovely to have you guys. Thank you very much. You know, you made our day because you never said a word and you look great by the end too as well. Shiza, do you want to wrap up the show?
Yeah, okay, definitely. If there's something that you need to write to us or any feedback about this show or anything else, write us on our Facebook page.
Which is with the name of World This Morning.
Twitter,
Well, this morning without a G.
YouTube, Daily Motion.
Well, this morning,
And the repeat is going to be at
11 p.m.
Till then, ladies and gentlemen, till we meet next time. Take care. Have a very good day. And
1, 2, 3. Good morning.
Look young.